Um, some background on TrueMed. My partner and I are entrepreneurs. We've been in this game for a long time. Does that sound coming from me, or sorry, does that sound?
Sounds like a gym. Hold on.
Let me put my headphones on.
All right, and then Callie, unmute yourself, and then you'll be good.
Hey, can you guys hear me okay?
Yeah,
Good.
you're good.
Okay. So we started this company asking a simple question, which is that we talk about how exercise is medicine, but policy doesn't really reflect that. And what we've discovered and what we're really excited about, we're here to evangelize, is that there actually is a way where that's not just a buzzword where exercise is medicine, where it actually truly we can implement that. And we can actually implement it in a very seamless way where your customers can actually unlock medical tax advantage dollars that would be going to, interventions and pharma once people get sick. You can actually use a huge pot of medical money right now to save on fitness. And the key vehicle here is HSA, FSA accounts. So just to give everyone a background, you've probably heard of these accounts, but about 40% of the American people have a funded HSA, FSA. So about 40% of your customers have a funded HSA or FSA account, and 80% of Americans have access to one. So in your gym, 40% of people probably have an account right now they can use. And then the majority of people at the end of the year, when we do that open enrollment where we kind of click through it real quick, you might remember there's a part where it's like, would you like to contribute to HSA FSA? You can choose, a family now can choose $10,000. And this vehicle automatically pulls from a person's paycheck pre-tax money. So it's pre-tax money that's sitting in someone's account that they can generally use for qualified medical expenses. So generally those qualified medical expenses are, seen as once we get sick, once we have diabetes, once we have heart disease, right? For the statin, the metformin, the interventions. What we've actually found is that if you have a doctor's note, outlining how CrossFit, how exercise can reverse or prevent a condition, then you can use that money to pay for CrossFit. So again, it's key that it can be a prevention plan for the customer, even if they don't have any full-fledged chronic conditions. 65% of the country does have a chronic condition, but even if somebody doesn't have, if somebody has a family history or is at risk for diabetes, we can create a doctor-recommended plan explaining the science of how CrossFit can help continue to prevent that condition, and that unlocks their ability to pay for the affiliate, for CrossFit, in order to pay for the gym with tax-free money. And then just to be really clear on this, that's unlocking a significant savings for your customer, right? That's 30 to 40% savings, this tax-free money that's already sitting there. So what we're seeing as we've launched this, working with leading brands, in the fitness space, in the supplement space, sauna companies, cold plunges, healthy food companies, we're seeing a significant increase in retention. It's just simple kind of economics. As these accounts are opened up for folks, and they have this free money, this effective 30 to 40% savings, which is calculated by the average tax rate, they're more likely to have that money to pay for the gym. So at a high level, that's what we're offering your customers. And I'm going to walk through a flow, and we've tried to make this as seamless as possible. But we have a flow where you're able, as an affiliate, to create a custom link, which is basically our medical intake survey, and give that to customers, either prospective clients who are thinking about but potentially have price concerns. When you're talking to them one-on-one on your website, on your emails to prospective customers, you can offer them this link, which enables them to take a quick telehealth survey and qualify for HSA, FSA. Also, it works very well, and we've seen great success, Jim. And I don't know if any folks in the call have been in our trial group, but we've seen very good success in our trial affiliates messaging their existing customers. So for existing customers, you email them our survey, and they're able to then qualify for reimbursement going forward on their future payments to you. And for the customer, let me just walk through this real quick. So, let me just show you exactly how this will work. See my screen here? This is a link I'll send to the chat, but this is for you. This is for the affiliate owners. And you will be able to click here and create your own account where you'll get a link from us. Okay. And on this page, we explain what the benefits are. We're seeing higher for some gyms, people that use us, their retention goes up 42%. We're seeing great. It outlines that. And then it recaps the instructions, which is just sign up as a merchant, receive your custom link, and market it to your audience. And then continually we'll add here frequently asked questions. And through email, you'll have our number you can text, you'll have our email, you can email, we will send you emails. We'll give best practices on marketing tactics. But the marketing tactics are really around emailing your customer lists, and having, as you're working with prospective customers in the gym, we're seeing it work really well when there's that potential price concern where you're working to get somebody on that monthly membership. You can mention that it's HSA, FSA eligible. And we're also working with Jen and the team to send other collateral like pamphlets to your gym. But this will take about 5 minutes to sign up. You'll get that link and you just have to merchandise that link to customers to basically offer them that 35% savings. For our initial test on how the payment works, gyms have actually the individual affiliates have been paying themselves and seeing an insignificant ROI. For our wide rollout, there'll be a charge for the customer at the end of the survey. So it doesn't cost you anything. The customer with their HSA or FSA card will pay $30 at the end of the survey. That's the cost for our telehealth work. We're having a doctor review this and issue them a note, which enables them to reimburse CrossFit. So it's no cost to you. Customers who understand the ROI understand that they can use their thousands of dollars sitting in their HSA, FSA for actually something that's going to keep them healthy, like CrossFit. That they pay that small fee to unlock that savings, which is tested well. But just wanted to flag that it's no cost to you. This is just a tool. Again, just to kind of wrap it up, and I'd love to take any questions. Our literal statement when starting this company is CrossFit is medicine. How do we enable people doing the right things? People running CrossFit gyms, trying to change people's lives. That was our goal starting this company. And I do think just simple economics is if you can save people 30, 40%, obviously everyone wants to be a member of your gym, but economics dictate a lot. And we're seeing great success. And my goal is just to answer all your questions and learn and make sure this is a tool that can drive more success to your business. We've been seeing that with our initial tests very strongly. And just to reiterate, this is the start of the conversation. We will have a text and email, and we're happy to do calls individually to make sure this is enabling your gym to be successful. So can dive into a lot more areas more specifically, but I'll take a pause there and Jen can answer any questions.
Yeah, so we had a question in the chat box. Will this work for nutrition coaching as well?
Great question. So that's another thing I'm working to learn. So in our initial rollout, we've rolled it, and just to preempt another question, this is national. This is national in the US. This is a US program. I don't know if there's any international, but this is a US program. I'll send the link. You create a special link for your own gym, and then you're able to send that out to your customers. And then that link, your login that you established, you'll be able to see which members of your gym have used us. As far as that question of nutrition coaching, in our trial program, we've worked with a number of affiliates who have supplements that they sell, who offer additional nutrition coaching, things like that. We are evangelical about approving anything that helps metabolic health. So supplements fall into that, nutrition coaching, other ancillary services you might offer that help somebody improve their fitness and improve their underlying health, we can put in the letter of medical necessity. So that would be something you would want to email us on a one-off basis, and we can analyze that with our clinical team, but they have to approve everything, but put that in the note. So then you could advertise to your customers that not only that note that they pay for would include their CrossFit purchases, but also include potential supplements or nutrition coaching or anything in that realm. That's what we're here to do. We're here to evangelize and drive success for all of those items. If I see consistently that there's a number of things that keep coming up, we can add that into the master note. We're thinking about adding a couple of supplements that a lot of people are requesting into the note. Yeah, so you can message to your customer that those things are included. Just email us if there's specific things you want to have considered included in the note. But that's where the rubber hits the road, right? I just want to jam this home again and again so everyone understands it. You get a link, a telehealth link for the customer. You can give them that. They take that, and then they receive a doctor's note affirming they can reimburse CrossFit and other items that allows them to save that money.
Awesome. And then someone asked, what is the percentage of people that are accepted? What is the cut for TrueMed?
Yeah. So we're the customer will pay $30 at the end of the survey, which goes to us, which helps pay for the telehealth compliance work. We've got, we're doing this right. And I've met personally with the White House, with members of Congress. We have the top telehealth law firm. So we're taking on all of that compliance and telehealth work. So that comes out of our cost. But the way we make money is the customer at the end of the survey, and this is something to message to them, right? That survey is a telehealth survey that allows them to unlock a year's worth of reimbursement on CrossFit and any other items. It will only charge them if they're approved. Just preempting a couple other questions here. Over 97% of people currently are approved. And just to give the thinking on this, the IRS is clear that a doctor's note counts for the prevention or reversal. So 65% of the American people have a chronic condition, as I said, so they're automatic, and there's clear research on almost any chronic condition imaginable of how exercise can help reverse it. So we substantiate that. But also almost everyone else should be and is identifying risk factors for diabetes, heart disease, obesity, and other metabolic conditions. And we create and tie exercise to a prevention plan for those conditions. So the way you get immediately rejected is if you identify no issue, no family history, no risk factors, no disease you're trying to prevent. But that's only about 1 to 2% of people. Everything's at the discretion of our healthcare providers, but we're very evangelical. Something we go to a lot is that the American Heart Association has given guidance. They say every adult should be prescribed a statin. Every adult in America should be prescribed a drug. Because there's such a metabolic health crisis, we agree there's a crisis. We think everyone in the country should be prescribed CrossFit as a prevention plan before drugs. So we're taking the same logic. So a lot of people, that's how people are approved. And Jen, I'll take a breath there. I want to make sure I'm addressing every question, but just preempting a couple other questions I see here.
Yeah, so I think a couple questions kind of go about like how the gym gets paid, how they get reimbursed, and things like that. Can you clarify?
Yeah, so this is an enablement tool for your gym. So they don't change with TrueMed how they're paying you. You just charge them how you would regularly charge them. So I think that's one of the benefits of this. You can put them on the regular subscription, right? And we're not touching your payment rails, nor do you really want to, because the HSA card's like a debit card and it might run out. So your messaging to them is they pay you the normal way. And then what TrueMed does is it offers that letter of medical necessity so they can reimburse their payments to you with their tax-free money. So they're just running on your subscription. And then this is a tool to unlock tax-free money to reimburse their payments to you. So somebody with an HSA or an FSA, they've got a bank account with special medical money. And when they get our receipt, our letter of medical necessity, they're able to then take your payments to you and just reimburse themselves. And the way that works with HSA is they can just take the money out of their account, what they paid you, and reimburse themselves. Our process makes that legal. So your messaging to them as you're closing a new customer is, hey, take this survey. It'll only charge you if you're approved, and you can see and get certainty whether you'll be able to reimburse your payments to us with HSA FSA. Anyone that has an HSA FSA, that will make sense to them. If they don't have an HSA FSA funded yet, you can tell them, well, maybe you probably have access to it. You can bulk up on contributions and have those for next year, because we're coming up on the time where people make their choices. But that's how it's worked. And I saw another question: what if they're declined by the HSA FSA administrator? What if they submit their receipts and then they're rejected? We guarantee acceptance. And we'll put this in our messaging, but we guarantee to the customer that they will be reimbursed correctly, and that they will fully be compliant. And we will actually pay out of our pocket if there is any rejection. And that is something we offer. We have been, as I said, in touch with members of Congress and the White House. And I'll just send you this link just so you guys have it. Something we think is interesting. This is actually from the largest HSA FSA administrator, Optum, who we're very closely in touch with, and actually explaining how exercise counts. These are the people approving the HSA. It's very well established that exercise, if it's written in a doctor's note, counts for reimbursing. So we guarantee that. Hope that answers the question.
Yep, that does. So someone had asked about giving detail on the survey that a member would go through, like what questions they go through. So do you have like that pulled up to the questions they get asked?
Absolutely. As I'm pulling this up, I'll just tell you guys that it's a simple telehealth intake, like going to your doctor and answering the couple of questions. So let me just pull this up. You guys got my screen?
Yes.
Okay. So first we ask, so what we are doing is substantiating, again, the CrossFit counts for HSA FSA if it is tied to a prevention or reversal. So we're substantiating, as I said, 65% of the country has some kind of chronic condition. We substantiate that. Just put something here. We substantiate whether they're working on preventing a condition, family history, and any biomarkers, and then an open-ended field. Then it's just a couple quick questions like this and their name. That's basically what a doctor asks you as you go into their office. You know, what medications you on? Are you currently feeling any symptoms? And we've worked with the telehealth lead telehealth attorneys to create, a compliant asynchronous survey. But what we're looking for is to substantiate what, and that's it. It's substantiating a condition that people are working to prevent or reverse. Our kind of clinical philosophy and our philosophy on this is that the metabolic health crisis, this connected group of chronic conditions, diabetes, heart disease, even dementia, Alzheimer's, which is now called type 3 diabetes, these are all essentially food and exercise, lack of exercise-borne illnesses, and they're all connected. And if we can substantiate that somebody is either facing obesity, diabetes, et cetera, or trying to prevent it, the science is very clear. We substantiate this in the note that we send, that CrossFit's one of the best possible things you can do as a treatment plan. So that's what the survey looks like.
Awesome. So another question was the $30 that's charged to the member, is that charged annually? I'm guessing their doctor's note is only good for a year, or how is that?
Yeah, as it stands right now, that is a one-time charge, and in a really good situation where they're members for the next year, they'll have to renew it in order to unlock their HSA. By statute, we can only issue the doctor's notes that we issue are kind of like a plan, right? So we have to reassess after a year. The notes can only be active for a year, so we do not have a subscription. We might look into that, but right now it's a one-time The messaging to your customers is pretty clear, right? It's like, hey, do you have an HSA account at $1,000 in there? You can unlock that to pay for CrossFit. And going into next year, you can contribute more for your, if you have families, husband and wife, a family can contribute $10,000. They can buy their CrossFit, they can buy their equipment, they can buy their supplements. Again, email us if you want us to, if your clients are asking, hey, I really want protein powder, I really want certain supplements, we could add those into your notes. So the goal here, right, is to just, it's an easy thing. So it's $30 to unlock that. But because the average tax rate is 30%, if they're spending more than $100 on their year's worth of payments to you, then that pays for itself after $100 on average.
Yep, definitely. And so a couple questions, and I can kind of address this too, is like about reimbursement with HSA. From my understanding, that varies by company, if it's monthly or quarterly, things like that, and that we would just, as affiliate owners, provide the receipt that they would need to give to their HSA. Is that correct?
Yeah, so we have not had problems with the receipts, and you as an affiliate owner will not need to do any type of custom receipt. You probably have something from your system or Stripe or whoever charges that just like says CrossFit membership and says the price every time they're charged. So we haven't seen issues with that, but technically the customer does need any type of receipt that shows the charge in order to do reimbursement. Just one little nuance on there, just for the customer, it's very seamless. They actually, for HSAs, often don't even need to show the administrator the receipt. It's actually, they can just reimburse whatever they've paid. You basically just need our note and substantiation of the receipts if there ever is a compliance question. Those are the two things you need to be compliant. But yeah, they need to be compliant. A receipt, it should just be the normal receipt you send. There's nothing really special you need to do, and our note.
Got it. Perfect. And then just so I can make sure I'm kind of reading some comments. So big picture, as an affiliate owner, I create the link, I share it with my members. They go online, complete the survey. Then they pay their $30. They get their letter of medical necessity. Things continue as normal. I can see in my dashboard that they've been approved. They've gotten their letter. They will take care of working with their HSA for that, and then just kind of move through. Is that big picture, like how everything works?
Yeah, and we message this to the customers. And just to be clear, any customer that you have, and there might be questions, I do not expect that you're going to get a ton of questions if you ensure that the customers using this have an HSA FSA account. The main questions we get is that, and this is fine, but some people who don't have an HSA who think it's for something else, and they're like, well, I don't have it, after they take the survey. And we'll refund them, and we'll be fine. And frankly, the fact that we're charging the customer makes it a little bit more of a process where I don't expect that to be happening a lot. I do not expect you're going to be getting a lot of questions about the mechanics of this, because anyone with an HSA FSA, this is how they reimburse their doctor's note, their pharma prescriptions. They go in and reimburse themselves. And the messaging to them, number one, is that they just reimburse their CrossFit receipts as they normally would. I saw a question on how often they should reimburse. They need to do it once a year. They need to just basically do it once a calendar year. If they want to reimburse every month or every quarter, they're welcome to do that. A lot of people just kind of save up to the end of the year. They have that certainty. And again, this is what I think is good from a business perspective. They're getting that certainty in their head that they've got that pool of money that they're able to reimburse at the end of the year. And then they're just a little bit, I think, psychologically, right? They're less eager to check in on that subscription churn. And they've psychologically got that pool of money that's waiting. So they need to do it once a year. And just to be clear, we'll continue adding to the FAQs in the page that we'll send you guys. But we'll have a bunch of FAQs. You can always refer your customers to us, to team@truemed.com, and we'll put this in the materials. And we're here to answer customer support questions.
Yeah, definitely. And I think there's several questions kind of going back and forth, and I don't know if they're like delayed or not, about like, we as affiliate owners are not taking their HSA card. We're taking their normal payment. They then will go get reimbursed. with their HSA, right? So we're not
Yeah.
because we're not setting up their HSA card in our system to collect payments.
Yeah, I think there's some, this is hopefully a very seamless process, but just to reiterate the customer flow one more time. So I'll send you the TrueMed link for affiliates. You create your custom, you sign up with your gym name and you'll get your link. That sign in you created for TrueMed, you'll be able to see who uses the link, what customers have used it, just so you know. You share that link with folks. They don't touch your payment. You can just tell them to pay as you normally would. This is an additional service that you're offering to unlock HSA, FSA for them. This is getting a little bit in the weeds here. It's possible that them putting your actual charges on their HSA card would work. And some customers are kind of hacking that, and that's fine. It charges right on their HSA card. We generally like to, you can say that if pushed or, even suggest it. There's just sometimes complications with using the HSA FSA card. We generally, I think, like to just have their regular credit card on there and then have that reimbursement step. We found that isn't that much friction for the customer. They're reimbursing most of their charges. And then it's good to have their regular credit card on there that most likely isn't going to get declined or run out of money, and then they reimburse it. But technically the customer might be able to put their HSA card on their actual payments for you. And that's kind of their choice. There is a possible decline there. It's just a little bit of a black box there with those acceptance rates.
Yep, definitely. And I'll kind of answer some of these questions really quick. So it is 100% of their membership would be covered, if including like personal training, because that's part of their membership as well. So they would submit for reimbursement along with that letter of medical necessity. Yes, as an affiliate owner, and I'm kind of going back and forth. So as an affiliate owner, we will have our own personal link. And Callie and the team will provide us with verbiage that we can send to existing members, new members, to include that link and things to say. I know, Callie, you've been working on some more media stuff for us as affiliate owners, and things. So if there's something that you think that would be beneficial to you other than like talking points and email templates, please throw that in the chat so that we can make sure that Callie and the team at TrueMed will take care of that for us. There, I'm trying to think. Someone asked, yes, this is being recorded. So if you jumped in late and you don't get your question answered, we probably have already answered that question. So you can go in and watch that. Another question is, how can people find out if they have an HSA account? I mean this with all due respect. They probably know if they have an HSA account. They have to do annual enrollment at their employer every year, October to November, somewhere like that, where they set it up. So if they're not sure, they can talk with their benefits administrator at their employer to find out if they have an HSA or an FSA. It's also a great enrollment time. It's getting ready to come up. You can talk about it. And if the members don't have that, they can kind of be pushed into possibly choosing that for their option there. Let's see. Oh yeah, Melanie said the same thing. Perfect timing for open enrollment. Callie, Dan and asked about the IRS. Do they have their blessing? Are they still reviewing this? Are they unaware? I know you've talked about this a little bit, so we kind of talk about that. You're in.
Yeah. So for a year before starting this company, I've been my previous career early on, I've been an entrepreneur for 10 years. My family's on a mission. My sister is a physician who started a company, Levels Health, which helps people measure their glucose and optimize their metabolic health. And I've been on this mission for a while. Previously, early in my career, I was in politics. And I've been doing some podcasts really calling out, I think, our rigged healthcare, not to get too on a tangent here, but really feel like our incentives of healthcare are for people to be sick. That message is really resonating with a lot of members of Congress and even the White House. It's bipartisan. And we met with the IRS lead at the White House to confirm this. and the members of Congress who oversee HSA, FSA. So it's enforced by the IRS. We got the stamp from the White House that this is consistent with their understanding. And then I'm not sure if you're familiar with Representative Dan Crenshaw from Texas, but he's on the committee that oversees HSA. I did a podcast with him, and actually on YouTube we talk about it, and he affirms on the podcast that this is a great interpretation. Again, like a lot of members, there's actually, I don't know if I mentioned this, there's a bill from some members that is trying to get exercise automatically approved, that they could just not need our note. I think it's ridiculous that we exist. I think everyone should be seamlessly giving tax advantage medical dollars to if you follow the science, CrossFit should be incentivized by healthcare policy. So just to be clear, right? But the law is, and this is unambiguous. I sent the link earlier from the HSA FSA administrator. This is up the fairway and unambiguous. If a doctor prescribes and talks about how exercise can be part of a prevention plan, it counts. This is not a cute interpretation. This is substantiated in IRS publication 502 that exercise counts if substantiated by a physician. So no, we're just taking what smart functional medicine doctors are doing. Mark Hyman is an investor and advisor for us. At his clinics, he does prescribe exercise. Smart doctors are writing notes for exercises. We're bringing that to the masses. And most doctors who your clients go to, they're in the traditional system. They probably wouldn't even, be able to or know how to prescribe food or exercise. So that's what we're doing. And it's fully, we guarantee acceptance. We take full risk. We're guaranteeing compliance here.
Awesome. Perfect. Thank you for clarifying that. Someone just recently asked about some of their members have an HRA from Employee Benefits Corporation. Will that work?
This is mainly for I can't speak definitively that this is for HSA and FSA. If the HRA, if exercise can be substantiated with the note from a doctor, it seems like some people are doing that, but I can't give a definitive statement on that.
Okay, awesome. Yeah, so I think definitely there's a lot of kind of random questions coming in now. So what I'll kind of do is just kind of talk about like next steps, and then we can kind of circle back to questions from that. So next steps, as affiliate owners, I can send everyone that registered for this call, I can send you this recording there, and then also send you the link. I know Callie had said he might post it in the chat, but I'll send you the link as well, so that you can register as an affiliate owner for that. And then it comes with all the documentation to send out to your members, like an email template. We are also working on some additional communications, and I think someone mentioned a PowerPoint with a quick like bullet points. Definitely love some things like that. Ideas that would make it easier for you, even sending you the idea of doing a QR code with your affiliate and just kind of setting it up there. So Callie, what other information do you have for us? And then I'll try to kind of scroll through the comments again, make sure I didn't miss anything major.
Yeah, great. So I just I'm going to paste this one more time. 1 second. TrueMed.com/CrossFit.
Awesome.
Posting that in the link. And let me just so we're 100% on the same page here, guys. Okay, so let's just go through this step by step just one more time, because hopefully we've really been working to make this simple, and I do think it's like, obviously new process. So let's just go through this one more time. This is the page you go to. You click get started. You'll have the sign up link. You put your gym name in here that the customers want to see, and then your other information. Okay. The next page, you'll get a link. We will be following up with more marketing tactics, with draft email copy, with things like that. What you want to do, I think, immediately is think about prospective customers. Just be ready to send that link to your customers. Put it on the website, on the payment page. Just one line of text, say you can qualify for HSA, FSA. You just want to be thinking about, as people are considering and price sensitive, you want to have that for them. And then we will follow up with you with an automated email with a suggestion on how to send that link to current customers. but it's a no-brainer to send to your entire customer list because it's giving them, especially as funds are expiring and they're thinking about renewing their funds going into next year, it's giving them that ability, right, to use these funds for the next year. So those are the two things. It's just talking this up with your customers one-on-one, and then emailing to both prospective customer list and current customer lists. I'll send a call link. I'm happy, and our team is happy to do a one-on-one call to make sure we're enabled. We're seeing on tests that are running this, right, we're seeing 20% of members use this. And we're seeing, Andrew's been talking about just re-engaging people who've lapsed, retention already. Like, we're seeing great success with this. So you should be seeing that, and we want to make sure you're seeing that. So we'll follow up, but like, you can schedule a call with us, text us, or email us. We're here, and you should be seeing a material number of your current subscribers use this and excited, to use that free money to stay at your gym. If you're not seeing that, we want to talk, because our mission of this company is to make CrossFit successful. And, we have aspirations of attacking Capitol Hill, showing how your members are healthier than the average people, and how, frankly, government money should just be flowing to your gyms without any friction. So if you're not seeing success, let us know. But yeah, you sign up and you get that link to people, and we will be working on other collateral such as receipts and pamphlets and things like that. But we're here to learn. We're here to enable you. So please send us ideas or other questions. And we should be updating that site regularly, truemed.com/CrossFit. As we get questions from you and as we see other areas we can improve on, we'll check that site. That's for you, for affiliates to have information to help enable you. We'll keep updating that site.
Yep, definitely. So I appreciate that. One quick question, and I'm kind of like reading the chat. As affiliate owners, depending on like what your history of employment or business ownership or just knowledge of things, you may not know specifically what an HSA is. And I'll just kind of reference like big corporations, when they offer monthly insurance to their employees, you can choose a plan that's normally a higher deductible, but you contribute to a monthly health savings account. So that's what the HSA stands for, and then the FSA. So you contribute monthly to that. So you build that fund up. If it's an HSA, that money rolls over year to year. So it can be there for, a copay at the doctor. It could be there for a prescription. You can buy like medical stuff that you might need at like Walgreens or CVS, something like that. So that would be like where those funds would come from, that they would get reimbursed. So they have to contribute so much monthly for their insurance to go towards that account. So they would get reimbursed back that way. And that's where the savings difference comes from. That's a like big picture overview of an HSA. We can link some stuff in the comments for like more details on an HSA, FSA, what that is there. And then someone had asked about the $30. So when they go through and do the member does their survey, they pay that $30 that one time. There's no cost to affiliate owners with this model. It's your member is paying that. There's no yearly charge. There's like nothing. So this is technically just a free resource for us for retention purposes, and also capturing some new members that maybe have, money that they contribute to their HSA. I know when I was part of a bank, the bank contributed money to the HSA if I just answered so many questions throughout the year and, checked in health wise. And so technically my employer could have paid for my CrossFit membership. So that. Yeah. Awesome.
Does this sound, yeah, guys, it's amazing to be, again, we're here to evangelize and help you guys. Jen, maybe if we have a transcript of the questions, I can look through them and follow up with an email, just answering any other ones.
Yeah.
And Jen, I'll have a couple thoughts follow up, and we can give a call link if anyone wants to talk with us or text with us. We'll establish a text link too. But I see a lot of people signing up. People signing up, you see your link that you have, and then continue to go to truemed.com/CrossFit, where we'll have best practices, and we'll also have an email to you today with that email. That email, if you put that link in an email to current customers, it should work really well. And I think, again, we're testing this. We have been charging the gyms up until this point, which is a super frictionless for the customers, which has driven high ROI. You might need to message, right, that $30 charge. If they spend more than $100 in a year, it's going to pay for itself. And it's basically like a quick doctor's appointment charge.
Yeah, definitely. So I will, again, Cali affiliate owners, thank you all for joining our call. I will send out a follow-up email with the link to this, all of these resources from Cali. If you missed this, definitely the email will have Cali's information, all that stuff. So if you have other questions, if you need more explanation on what HSA is, how to get reimbursed, what the cost is, like anything from A to Z, I would say there's several affiliate owners that we can connect you with that have had great success in how they've modeled this and how we've set it up. Also, Cali is a great resource for all things, technical and above my head sometimes about all that stuff. But I appreciate you guys jumping on. I'll stay on for a few minutes so I can capture any other questions that come in. But you guys have 15 minutes back in your day to go get a workout. So.
And don't mean to sound too cheesy here, but thank you guys for being on the front lines here. And we're just so grateful to work to try to enable you and steer medical dollars in the right direction. We're here to be long-term partners. Thank you guys. And hope to, really, really optimistic about this. Thank you.
Thanks, Cali.
Thanks, Jen. Should I drop?
It doesn't matter. So
Okay.
I'm just gonna hang out here and capture questions. So for
Nice.
you, yeah.
Okay.
I'm gonna stop recording.